നമസ്കാരം ഹെൽത്ത് ടൈമിലേക്ക് സ്വാഗതം. ഓട്ടിസം ചികിത്സയിൽ ഒക്യുപേഷണൽ തെറാപ്പിയുടെ പ്രാധാന്യം എന്ന വിഷയമാണ് ഇന്ന് ഹെൽത്ത് ടൈം ചർച്ച ചെയ്യുന്നത്. ലോറം വെൽനസ് കെയറിലെ ഒക്യുപേഷണൽ തെറാപ്പിസ്റ്റ് ഡോക്ടർ നരേഷ് ബാബു കരുണാകരനാണ് നമുക്കൊപ്പം ചേരുന്നത്. ഡോക്ടർ നമസ്കാരം.
നമസ്കാരം.
ആദ്യമേ ചോദിക്കട്ടെ, ഈ ഒക്യുപേഷണൽ തെറാപ്പി എന്താണെന്ന് ഇപ്പോഴും പലർക്കും അറിയില്ല. എന്താണ് ശരിക്കും ഈ ഒക്യുപേഷണൽ തെറാപ്പി എന്ന് പറയുന്നത്?
ஆக்குபேஷனல் தெரப்பி இப்போ ஆட்டிசமில் அதிகமாயிட்டு சொல்லப்படுறது சென்சரி இன்டிகிரேஷன் தெரப்பி. அதில் ஒரு ஸ்பெஷலைஸ்ட் அப்ரோச் ஆனிட்டு. ஆனால் ஆக்குபேஷனல் தெரப்பி இஸ் த மேஜர் ப்ரொஃபஷன் ஃபார் டீலிங் வித் ஆல் த ஃபிசிக்கல் டிசபிலிட்டிஸ் அண்ட் ஆல்சோ மென்டல் டிசபிலிட்டிஸ். இங்கே ஆக்குபேஷனல் தெரப்பி இட்ஸ் ஆக்சுவலி டீல்ஸ் வித் அன் ஆர்ட் அண்ட் கிராஃப்ட் activities initially, and later on it went up to the forming the goals on maintaining the physical, cognitive and social and emotional disorders. So usually we use a lot of meaningful activities and purposeful activities to deal with these children and to promote their major functional performance towards to the optimal functioning of their life.
ഇപ്പോൾ ഇതിൽ പ്രധാനമായിട്ടും എല്ലാവർക്കും ഉണ്ടാകുന്ന സംശയം, എങ്ങനെയാണ് ഓട്ടിസത്തിൽ ഒക്യുപേഷണൽ തെറാപ്പിയുടെ ഒരു പ്രാധാന്യം എന്താണ്, അതിൻ്റെ റോൾ എങ്ങനെയാണ് വരുന്നത് എന്നുള്ളത്?
Occupational therapy role actually it combines with a comprehensive treatment plan. We actually makes an evaluation. Initially the screening program happens, how these children are affected and what functionality they have been dealing with. Mainly the children they have a function difficulty in play, so they doesn't know how to interact with other dealings, how to ask their needs, and mainly to deal with their parents. So parents also having an issues of functional performance, like how to handle these children in their emotional behaviors and other issues in asking for their needs in their daily life. So we used to plan a kind of a strategies for them to know about it by making a screening plan, then evaluation, and then providing the strategies to handle it in their home as well as in the other setups.
ഇപ്പോൾ ഇതിൽ ഈ ഒക്യുപേഷണൽ തെറാപ്പിയിലൂടെ ഈ കുട്ടിയെ ഒരു സാധാരണ ജീവിതത്തിൽ, ഓട്ടിസം ബാധിക്കുന്ന ഒരു കുട്ടിയെ സാധാരണ ജീവിതത്തിലേക്ക് കൊണ്ടുവരാനുള്ള ഒരു സാധ്യതകൾ എങ്ങനെയാണ്, അതിൻ്റെ ഒരു ചാൻസസ് ഉള്ളത്?
Autism കുട്ടികളാണിട്ട് we never call them having some kind of a condition. It's actually a neurophysiological condition where they forming from the beginning, but we don't deal with that. We only check with the sensory issues of the child when they are affecting their daily living functions, how to play with them, how to deal with them, how to attach with other peoples, how to engage with the other children, to making them to play with their siblings. So these issues, when parents doesn't know how to provide them kind of a comfort and needs to them. So this will be identified by the occupational therapist. So we set a goals, mainly like physical goals, like if they are having any limitations to reach to the play. So here mainly the limitations is on the sensory issues, like visual issues or tactile issues. Mainly when we are providing some kind of a dressing, the children can't able to accept it. When they are cuddling, when they are giving hugging, these children might try to avoid from that. It looks like they are not able to conceive those kind of a support. So that will be identified by us, and we give kind of a sensory integration therapy to deal with that, and these children can engage with other children also.
ഇപ്പോൾ ഏത് ഘട്ടത്തിലാണ് ഒരു ഒക്യുപേഷണൽ തെറാപ്പിസ്റ്റിന്റെ ഒരു സഹായം ഈ ഓട്ടിസം ബാധിച്ച കുട്ടികളുടെ പാരന്റ്സ് സ്വീകരിക്കേണ്ടത്, അത് ചെയ്യേണ്ടത്?
Mainly make them to engage in purposeful activities. So autism particular parents, they need to select those activities which should not have more than 3 failures. So that is most important, which many might not be knowing. It should not be more complex. It has to be very simple, and that set goal has to have some kind of a satisfaction, sense of achievement has to be there. There should not be any sense of failure. So that will actually make them self-esteem very low and can't able to promote to the other interest of doing the activities. So mainly as an occupational therapist, we always deal with the intrinsic motivation, which is we always believe on play. Play is the most important work or the need for the children. So that we will try to promote by giving a kind of a planned set of activities which makes them more interested in doing and learning, and also making their functional performance much achievable. like the most important thing is the self-care activities which these children are going to have a difficulties, which we will be addressing it, like mainly the eating disorders or feeding habits and those crankiness or some kind of hyperactivity that can be controlled through this sensory integration therapy.
ഈ ഓട്ടിസം ബാധിച്ച കുട്ടികളുടെ ഇപ്പം ഈ അടുത്ത കാലത്തൊക്കെ ഏറ്റവും കൂടുതൽ പേര് അതിന് ചികിത്സയിലേക്കൊക്കെ വരാറുണ്ട്. തിരിച്ചറിയാൻ ഫസ്റ്റ് സ്റ്റേജിലൊക്കെ തിരിച്ചറിയാൻ പലപ്പോഴും അറിയാതെ വരുമ്പോഴായിരിക്കും ഈ ഒരു സ്റ്റേജിലേക്ക് ഈ ഒരു ട്രീറ്റ്മെന്റിലേക്കൊക്കെ കടക്കാൻ വൈകുന്നത്. ഇപ്പോൾ ഇങ്ങനെ ഒരു ഘട്ടത്തിൽ ഈ ഓട്ടിസം ബാധിച്ച കുട്ടികളുടെ ഇപ്പൊ കൂടുതലായിട്ട് അങ്ങനെ വരുന്നുണ്ടെന്നാണ് ഡോക്ടർ കരുതുന്നത്. കൂടുതൽ പേര് വരുന്നുണ്ട്. അപ്പൊ ഈ എപ്പോഴാണ് ഈ ഒക്യുപേഷണൽ തെറാപ്പിയിലേക്ക് കടക്കുന്നത്? ആ ഒരു ആദ്യഘട്ടത്തിൽ തന്നെ ഈ ഒരു കുട്ടിക്ക് ഇങ്ങനെ ഓട്ടിസം ഉണ്ട് എന്ന് തിരിച്ചറിയുന്ന ഒരു ഘട്ടം ഉണ്ടാകുന്നു. അപ്പോൾ തന്നെ occupational therapy start ചെയ്യേണ്ടതുണ്ടോ?
இந்த குட்டிகளான பேரண்ட்ஸ் முதல்ல அட்ரஸ் பண்ணுறது ஸ்பீச் டிலே மட்டும்தான் அட்ரஸ் பண்ணுது. ஸோ எப்போ ஸ்பீச்சோட டிலே இருக்கோ மெனி ஆஃப் த டைம்ஸ் தே வெயிட் ஃபார் தர் ஸ்பீச் டு கம் அப். So அது ஒரு 3 years கழிஞ்சாயிட்டு they will think that the child is having a delay in some kind of a speech, they can't able to interact properly, then only they will try to approach to the doctors. So most of the doctors now they are aware about this profession, and if they approach to the clinical psychologist or to the pediatricians, they try to provide this impact that this screening has to be done. But most of the doctors also, even the family doctors, will wait for some kind of a moments whether the child is showing some kind of a progress or improvement, because sometimes they have other issues of emotional kind of a delay. So that they will wait for some time and then they ask them to go for the screening program. So that you used to do the MCHAT, which is a modified checklist for autism in toddlers. So that is the first screening we used to do it. In clinical psychologists, they used to do a childhood autism rating scale, which is CAR scale. So in that, any kind of a category is very less than 32.5 risk factors will be identified, and then they will be suggesting for the occupational therapy and other therapy services.
ഇപ്പോൾ ഈ ഓട്ടിസത്തിന്റെ മാറ്റി നിർത്തിയാൽ ഈ ഒക്യുപേഷണൽ തെറാപ്പി എന്താ എന്നുള്ളത് ഇപ്പോഴും പലർക്കും അറിയില്ല എന്നതാണ് വസ്തുത. പലരും ചോദിക്കുമ്പോൾ ഇത് എന്താണ് ഇതെന്ന് ചോദിക്കുമ്പോൾ ഈ ഒക്യുപേഷനുമായി ബന്ധപ്പെട്ട എന്തോ എന്നൊക്കെയാണ് പലരും അങ്ങനെയാണോ എന്ന് ചോദിക്കുന്നത്. ശരിക്കും അപ്പോൾ ഈ ഓട്ടിസത്തിന്റെ മാത്രമല്ല അല്ലാതെയുള്ള ഏത് നോർമൽ പീപ്പിൾ ഏത് പേജിലുള്ള അല്ല ഏത് ഏജിലുള്ള ആളുകളാണെങ്കിലും ഈ ഒക്യുപേഷണൽ തെറാപ്പി എങ്ങനെയാണ് അവർക്കൊക്കെ ആർക്കൊക്കെയാണ് ഇത് വേണ്ടി വരുന്നത്, അതിന്റെ കൂടിയും ഒന്ന് പറയാം.
For anybody who has any kind of a physical limitations or cognitive limitations or emotional limitations, when they are going through with any kind of a conditions like stroke or any sudden kind of accidents through traumatic brain injury, so when they are affected with any functional difficulties of achieving their activities of daily living, which is self-care activities, then they need to approach to an occupational therapist. Because in occupational therapy, we always see any occupation as a means of doing the therapy. So every occupation has some kind of a therapeutic value into it, and that therapeutic value will be identified to treat that particular physical limitation clients. So this actually coincides with anybody, even without having any limitations, when they are going through some kind of a stress phases or any depressive phases, even a kind of a word or a strategy plan of an occupational therapist can change their entire functional performance of their life.
ഇപ്പോൾ ഡോക്ടർ ഇവിടെ കൊച്ചിയിലാണ്, ലോറം വെൽനസ് കെയറിലാണ് വർക്ക് ചെയ്യുന്നത്. അപ്പോൾ ഡോക്ടർക്ക് ഇവിടെ ഇപ്പോൾ കേരളത്തിലൊക്കെ വർക്ക് ചെയ്ത് തുടങ്ങിയപ്പോൾ എങ്ങനെയായിരുന്നു ഈ ഒരു അപ്രോച്ച് വരുന്നത് ഈ ഒരു പാരൻസിന്റെ ഭാഗത്ത്? ഇപ്പോൾ നമുക്ക് ഓട്ടിസത്തിലേക്ക് തന്നെ പോവുകയാണെങ്കിൽ ഈ കുട്ടികളുടെ ഭാഗത്ത് നിന്ന് ഈ പാരൻസിന്റെ ഭാഗത്ത് നിന്നൊക്കെ ഒരു അപ്രോച്ച് വരുന്നത് എങ്ങനെയാണ്?
I was actually working in Goa for more than 12 years. So அந்த நேரத்துலையும் நான் இங்கே கொச்சிக்கு அடிக்கடி கன்சல்டேஷன் ஆகிட்டு வந்ததுண்டு. There was a pre-vocational center where I was attached to through it, and I also worked in Indian school Muscat, where lot of children are from Kerala. So I used to through the parents I was always connected with them. But when I was working in a national institute, one of my pediatrician, Dr. Vijay Lakshmi ma'am, she is also from Kerala, and she was very attached whenever there is any projects or any projects related to the Kerala. So we used to be connected with that, and she always been interested in that. And second thing, I was also been selected for both the colleges, which is NISH, National Institute of Speech and Hearing, and also for NIPMR when they started the college. So we were initiated to start this occupational therapy profession in Kerala, which was actually a much advanced educational center in all over the country. So, but when it started, I couldn't able to move on because I have to complete my PhD. So that is my most advanced course which I want to complete in India. So then this project Lorem Wellness Care has started. So which made me more interested connecting with my one of our good friends. So that initiated me to join this particular project through one of my good. Physiotherapist who is also a associate professor and a principal of my management's college. So that initiated me to move on to here, and from the day one onwards, we conducted the autism awareness program on the first day when I joined on April 1st. So that week is an autism awareness program. So we conducted free of cost, voluntarily. Many people has joined, and then from the day begin, we started. Actually, we feel little sorry because we are getting more kind of children. Actually, we never expected that many children will get enrolled. But still, it's kept on growing. This condition has to be addressed. So initially, my company was having a plan to start a lot of other multidisciplinary for adults and neuro rehabilitation setup and geriatric rehabilitation. But now the focus, most importantly, going on the child development center. So because of the growing numbers of children getting enrolled and getting services also, we are getting a lot of progress, and many of them coming from abroad or getting more good progress, and they are getting back to their inclusion community.
ഇപ്പോൾ ഒരു പേഴ്സണലായിട്ട് ചോദിക്കുകയാണ്, ഈ ഒരു ഡോക്ടർ ഇങ്ങനെ ഒരു ഒക്യുപ്പേഷണൽ തെറാപ്പി ഇപ്പോഴും പലർക്കും അറിയില്ല എന്ന് പറഞ്ഞല്ലോ, ഇതിനെക്കുറിച്ച് അറിയില്ല, പക്ഷേ എപ്പോഴും ഡോക്ടർ ഇതിലേക്ക് കടന്നു വരാനുള്ളൊരു സാഹചര്യം എങ്ങനെയാണ് ഇങ്ങനെ ഒരു ഒക്യുപ്പേഷണൽ തെറാപ്പിസ്റ്റ് എന്ന രീതിയിലേക്ക് വരാം എന്ന് കരുതുന്നത് എന്തുകൊണ്ടായിരുന്നു? അത് അന്ന് അത്രയും ഡോക്ടർ ഇത് പഠിക്കാൻ വരുന്ന കാലത്തൊക്കെ അത്രയും പ്രചാരത്തിൽ ഉണ്ടായിരുന്നതാണോ ഈ സംഭവം?
When I started this, I was also not knowing about occupational therapy. I got a free seat. I just put my what we say, the medical degree. So both for MBBS and for dental, I have approached it. In the dental form, we have B Form, BOT, BUPT, and lab technology, and also nursing. But nursing has a little kind of impact. Like if a male nurse getting joined, many of the time it looks like my mother used to say that when he will call as an attender, not as a nurse. So male nurse was not much popular at that time. And later other professions are not nearby. So when I went to, my principal was sitting in the admission area in the government free seat. So I approached him, I asked it, what is occupational therapy? He didn't give any kind of a word, he just showed an action using a hand. So where physiotherapy, they use the legs. So this is what they segregated it. Even in other Western countries, they have a segregation, like upper part of the body being handled by the occupational therapist and lower part of the body being handled by the physiotherapist. This is what the segregation given by them, but it's not actually true. Everything is needed. So we might be used to handle endurance activities rather than the strength-based activities, whereas physiotherapists, they will be handling the strength-based activities. So we don't think strength and other things it's needed, but we always believe on the endurance. So endurance is different. Like even we are having a fatigue or weakness in their hands when we want to sip the coffee. So it's not only the strength is needed to lift the coffee, it is also the endurance to hold and coordinate and to sip the coffee, to enjoy the coffee drinking. So this is what needed for everything. Like when we have an interest and little bit of endurance, then we can achieve any kind of a task without any difficulties. So that's what in occupational therapy we use it. So that most importantly, we try to develop that praxis movements like motor planning activities, which as this profession gets more impact in this autism children's. So that is what it is getting booming. Even we are being recognized in identifying the specific learning difficulty children's also. So this makes me to go forward for this profession. When I selected, my mother used to tell that both physiotherapy and occupational therapy, we can put a prefix called doctor. So that was been and a debate and included, but now it has been confirmed. Doctor is actually not a given process by any university. Even MBBS is called as a Bachelor of Medicine and Bachelor of Surgery, but it has been given by the person who treats or implements or screens and given the strategies, also been called as doctor, given by the public. But this actually made me to move on up to the doctorate degree, which I want to complete it to gain that as a proper doctor. So that made me an impact to join this profession as an occupational therapy and went on from 1999.
ഹൗ യു കം ടു ദ ഫീൽഡ് എന്നതായിരുന്നു. ഇനി ഇതിൽ ഇപ്പോൾ PhD ചെയ്യുന്നു. അപ്പോൾ എങ്ങനെയാണ് ഇതിൻ്റെ ഒരു PhDയുടെ ഒരു സാധ്യത, എന്താണ് ഇപ്പോൾ അതിലേക്ക് എടുക്കാനുള്ള ഒരു കാരണമൊക്കെ?
This doctorate degree actually before the 2019 we don't have much colleges to provide a doctoral degree in occupational therapy. We need to move on to the other western countries. நான் இங்கே பண்ணுறது இப்போ only in very few colleges where we attach to that college, then we can do it part time. But now I got an opportunity to do it in Santosh Medical College. It's a deemed university in Ghaziabad. So in that I have taken this topic on siblings with autism. So this is my favorite thing because every child is a major focus of their family. So family also been involved for this child because they shape their own limitations or their way of living will be changed according to the child's mode. So that's why I thought that when we address this issue, not as a particular condition of the child, we have to address it as a whole family, as a family-centered therapy. Because now nothing like a bottom-up approaches are very getting limited. So now it is top-down approaches, which is called focusing mostly on the affecting areas of their family. So that made me to choose this particular topic on siblings, where many of the children we might be knowing having this child like with any intellectual difficulty or this particular different type of children with autism. The parents doesn't want to go for the next child. So that make an impact that family gets very much focused to a particular child and they can't able to concentrate on the next other activities only to develop this particular child, and they become more interacting only for that child's life. So that should not be that as a whole family they can approach to. This child also needed some kind of a siblings instead of going for any pet therapy or other kind of a services. The sibling can make lot of changes with them family. So, and even the siblings are getting affected because they don't get much quality time of their parents when they are only focusing and running behind these children's. Through therapy centers and many schools and other therapy services, they kept on moving their time towards to the particular child, and they can't able to provide the quality time to the neurotypical child. So this made me to make them to connect how I can make the siblings, even though they are 24 hours presentable with them in their family itself, how can I connect that goal oriented approach with the siblings so that I can achieve the goals much faster and also save their time and also reaching the progress much faster for these children. So this made me to select this topic, and many research studies has come up with how to interact these neurotypical children to combine with that. My ethical committee, they actually given a kind of a one more support, like go beyond the level for checking the IVF children's like intrauterine and intrafertility. Now fertilities come up with a lot of making artificial children's. So that also actually makes a lot of impact, like when they are having twins, one of the child gets affected with some kind of a sensory processing difficulty. So that also we like to record it and how we can able to prevent this by doing the early intervention or early screening, so that they can be given lot of importance in the mainstream education development. So this PhD is mainly focused on that, like making that siblings, it's not only the blood related siblings, even the adopted children or the nearby child who can be very much attached to them or near to their family, who might be a neighbor child or a cousins, also plays a much bigger role to deal with these children, because it's not autism children is can't able to move on to the community. They are the most lovable and more important towards to the society nowadays. So their population is much approaching now, much children are coming up, so we can able to handle them in a better society as a community. And school-based occupational therapy also working out well, and much teachers are understanding now, and we can help them a better. So this approach is mainly focused on making that collective environment for this child, making as a positive-based environment to support them well.
ഡോക്ടർ ഇത്രയും ഈ ഒരു PhD അടക്കം ചെയ്യുന്നതുള്ളതുകൊണ്ട് ചോദിക്കാം, ഒരു പക്ഷേ ഇത് കേൾക്കുന്നവർക്ക് ആർക്കെങ്കിലും ഉപകാരമാവട്ടെ എന്ന് കരുതി ചോദിക്കുന്നത്. ഇപ്പോൾ ഇതിലേക്ക് ഈ ജോബ് സാധ്യതകളൊക്കെ ഉണ്ടല്ലോ, ചാൻസസ്. ഇപ്പോൾ ഈ തെറാപ്പിസ്റ്റ് ആയിട്ടുള്ള വരാൻ താല്പര്യമുള്ളവരൊക്കെ ഉണ്ടാവുമല്ലോ, ഇപ്പോൾ പഠിച്ചിറങ്ങുന്ന കുട്ടികൾ. അപ്പോൾ ഇതിൽ എങ്ങനെയാണ് ഇതിലേക്ക് അപ്രോച്ച് ചെയ്യേണ്ടത്, ഈ ഒരു ഏത് കോഴ്സ് എടുക്കുക, അങ്ങനെയുള്ള കാര്യങ്ങൾ കൂടി ഒന്ന് പറഞ്ഞു വയ്ക്കാമോ?
After plus two, they can go for the entrance examination. So nowadays, we are having a lot of. In Kerala, we have only 2 colleges. Still more colleges going to get approved. So still waiting for it. But now at present, we have a state colleges, which is NISH and NIPMR, and other places also now it is getting emerged. And most of the awareness is of getting the job in Kerala is much bigger for the profession. Now occupational therapy, everywhere the vacancy has come up because to address a lot of needs of our state people. So this making us more connected with a lot of hospitals. So this field, anybody who completes plus two in science, they can approach, they can complete this entrance examination and they can get this selection. And I think only nearly around 25 seats are available for both the colleges. And even many of them are doing in state government, in Tamil Nadu state government. We have nearly around 20 colleges. So they can, most of them are studying from Kerala. So they, once they complete and come back, then we'll be having a lot of, means it's a demand and supply. So the services can be moved on to all the places. So everybody will get the services at a very cheaper cost and also in a quality way. So that's what our motto is, and hopefully we will achieve it within 2 years.
ഡോക്ടർ ഈ പറഞ്ഞ ഈ 2 കോളേജുള്ളൂ കേരളത്തിലെന്ന് പറഞ്ഞു. ഇപ്പോൾ നമുക്ക് ടോപ്പിക്ക് മാറിപ്പോകുന്നതല്ല, ഇത് കൂടുതൽ പേർക്ക് അറിയാലോ എന്ന് കരുതി പറഞ്ഞത്. ഈ 2 കേരളത്തിൽ അത് കുറവാണ്. ഈ ഒരു ഇപ്പോഴും ഇപ്പോൾ തമിഴ്നാട്ടിലൊക്കെ കൂടുതൽ കോളേജസ് ഉണ്ട് എപ്പോഴും ഇതുമായി ബന്ധപ്പെട്ടില്ലേ. അപ്പോൾ കേരളത്തിലാണോ ഇതിൻ്റെ ഏറ്റവും കൂടുതൽ പേര് ഇതിനെക്കുറിച്ച് അത്ര ശ്രദ്ധിക്കാതെ പോകുന്നത് കൊണ്ടാണോ, അത് ഗവൺമെന്റിന്റെ ഭാഗത്തു നിന്നൊക്കെ അതിന്റെ ഒരു പ്രയോജനം കിട്ടാത്തതുകൊണ്ടാണോ, എങ്ങനെയാണ് അതിന്റെ ഒരു സാധ്യത കുറഞ്ഞു പോകുന്നത്? കൂടുന്നുണ്ട് இப்போ
கூடுதுண்டு. இதுக்கு முன்னாடி வெறும் நிறைய ஹாஸ்பிட்டல்ஸ் ஒன்லி இட்ஸ் டிபெண்ட்ஸ் அப்பான் how much the demand is happening. So much of the hospital will only know about physiotherapy. So அதுக்குண்டான சாதனங்கள், அதுக்குண்டான தேவைகள் அதிகமாயிட்டு அது இப்போதைக்கு தான் government has realized that this occupational therapy services are much needed to address even the speech delayed children's why it is getting affected. So they have come up with this lot of need even for regulating the skills. Now we have a national commission for allied health profession has been emerged, and it is in place, and it has already been act has been enacted. So once it is reaching, the council is taking chances, then many colleges will come. So many people will get enrolled into this course. But this course is 4.5 years course, like 4 years plus 6 months, and it takes like total of their life, 5 years of life. Then master degree, it's about 2 years. Then PhD is about other 4.5 years. So the people has to, like, it's like a MBBS. So when they couldn't able to join MBBS, then only they are taking this other option. Now actually many in their family itself, they are knowing about these children, and they are getting enrolled. Like mostly the siblings are ready to take these kind of courses. And when they, like I was in National Institute for Empowerment of People with Multiple Disabilities in Chennai, where if the siblings having some kind of a disability, 40% benchmark disability, their total fees will be waived for that 4 years, and it will be reimbursed and given all their support and need by the government. So it is getting awareness. So awareness is coming up, and I hope many will be understanding about this profession, and they will take the services.
നമുക്ക് ഈ പ്രോഗ്രാം കൺക്ലൂഡ് ചെയ്യാൻ സമയമായി. പക്ഷേ അതിന് മുൻപ് ഒറ്റ കാര്യം കൂടി ചോദിക്കണം. ഇപ്പോൾ നമ്മൾ നേരത്തെ പറഞ്ഞ ഈ ടോപ്പിക്കിൽ നിന്ന് ജസ്റ്റ് മാറിപ്പോയി എങ്കിൽ കൂടി ചോദിക്കണം, ഈ ചികിത്സാ രീതിയിൽ എന്തെങ്കിലും അതായത് ഓരോന്നും ഓരോ ടൈപ്പാണ്. ഇപ്പോൾ ഡോക്ടറുടെ തന്നെ ഒരു വീഡിയോ കണ്ടിട്ടുണ്ട്, ഈ ടോയ്സുമായി കണക്ട് ചെയ്തിട്ട് ഈ ട്രീറ്റ്മെന്റ് നടക്കുന്നത് ഈ ഓട്ടിസം ബാധിച്ചിട്ട്. അതെങ്ങനെയാണ് ഈ ടോയ്സിന്റെ ഉപയോഗം വരുന്നത്?
So anything actually, toy selection is the best by the occupational therapy. So any occupation, they need some kind of a movement activities which has to be engaged. So when we are connecting with the children as an adult, I can't go beyond the level as a child. I can't do other kind of a jokes or joker or any kind of a play. Even if we do also, we can't connect the child for the total 45 minutes of the session. We need some kind of a tool which we might use, not only the toy, we can use any piece of equipment can be moved on to the child, but it should be interesting, it should be fun playing, and makes the child to involve into it, so that there will be some learning parts will be there, and that learning fun can move on to develop their self-care activities. So that's why we use the toy selection. But most importantly, many will think about toy means that there is an age range will be kept on every toys boxes. But actually, we select the toys according to the child's need, cognitive needs, as well as the emotional needs and their creativity needs. So fun and creativity can be connected with the toys. That's why we always been a best in selecting the toys for the children, and it can be easily used by the parents in the home. So home-based therapy is the best by selecting of these toys.
നമ്മുടെ പ്രോഗ്രാമിന്റെ സമയം കഴിയുകയാണ്. എന്തായാലും ഒരുപാട് നന്ദി ഈ ഒരു ടോപ്പിക്കിൽ ഇത്രയധികം നേരം സംസാരിച്ചതിന്. ഓട്ടിസം ചികിത്സയിൽ ഒക്യുപേഷണൽ തെറാപ്പിയുടെ പ്രാധാന്യം എന്ന വിഷയമാണ് ചർച്ച ചെയ്തത്. ലോറം വെൽനസ് കെയറിലെ ഒക്യുപേഷണൽ തെറാപ്പിസ്റ്റ് ഡോക്ടർ നരേഷ് ബാബു കരുണാകരനാണ് നമുക്കൊപ്പം ചേർന്നത്. ഹെൽത്ത് ടൈം വീണ്ടും നാളെ. നമസ്കാരം.
നമസ്കാരം.